Hello, I'm David Rath. I'm a contributing editor for Healthcare Innovation, and I have with me today Thomas Charlton, the chairman and CEO of Goliath Technologies, positions he's held since 2011. Welcome, Thomas. It's nice to get a chance to talk with you. Maybe we could start if you tell us a little bit about your career background in healthcare, and then a little bit about the founding of Goliath.
My career started in with a healthcare company called US Surgical, and we provided health systems with stapling instruments for the operating room. So my familiarity with healthcare started from within the hospital. When I started Goliath Technologies, I was surprised to see that health systems were acquiring technology at such a rapid pace. But back then it was during the stage when they were digitizing all their medical records, right? So as part of the Recovery and Reinvestment Act, I believe it was the High Tech Act, it provided different financial incentives for health systems to adopt electronic medical records. So then I was reintroduced to healthcare, not through the operating room, but rather through the IT department. So it was sort of a reintroduction to a new paradigm in healthcare.
So now you have some of the largest health systems as clients for your company. How have you seen health IT change over the years from your perspective?
So, let's think about it for a second. So when organizations, it's really unbelievable when you think about an organization like a health system providing care for, in some cases, hundreds of thousands of people, moving from a paper-based system to an electronic medical record system. So just think about that. Literally in one day or over a course of time, you have 10,000 caregivers working with pen and paper. And now they're using laptops and desktops and things like that. So the change has been really unbelievable because all of that change has really fallen on the back of health IT to make it happen. Certainly the caregivers, the healthcare workers have to adopt these systems and learn how to utilize them. But IT has to keep those systems up, running, and available, which is no small feat.
Yeah. So now that all this data is digitized, what are some opportunities you see for innovation with that data?
I think the opportunities are really endless. When you think about now you have all of this centralized data, it enables much better quality of care. So take, for example, just something simple like trying to do predictive analysis. So looking at the leading indicators across hundreds and hundreds of thousands of different patients and trying to understand what the leading indicators are for heart attack or stroke or some other type of illness. Clinical trials is pretty interesting as well. If you think about how difficult a clinical trial is, it usually takes, my understanding is around 17 years to complete a clinical trial. Part of that reason is that only 3% of the people that are invited to a trial actually participate, 3%. So now you can do clinical trials or those level of assessments using data across hundreds of thousands of different patients across geographies, etc. So the ability to try to abstract the information you would need to approve a different course of therapy or a drug you can augment things like clinical trials, which are time-consuming, expensive, and highly inefficient, with good, solid data that's gathered by the various EMR, EHR applications.
So it sounds like we're talking about basically a whole new paradigm of care, and it sounds also like health IT folks their role is elevated in all of this and becomes more important.
Well, I think that when you think about it, IT is sort of the foundational element right? So yes, you have to customize the EMR, EHR to support healthcare workflows and business processes and things of that nature. Absolutely. But the application has to be available, it has to be reliable, and it has to perform. And that really comes down to IT's focus on those three foundational elements. If not, the application is going to be too difficult to use, and organizations will revert back to paper. We're taking notes in some other form or fashion. Certainly that happens if there's something as traumatic as downtime. If the application is unavailable, that causes very critical issues relative to patient care as well as collecting medical data.
So explain a little bit about Goliath's role in that process in monitoring like the efficiency of the EHRs, or how it works with the health systems in that way.
So take, for example, you're a large health system. You're running one of the major EMR, EHR applications, whether it's Cerner, Epic, or Meditech. Those are really the top three. And let's imagine that your workers are there, or clinicians are there 24/7, right? But what our technology will do, just one example of a feature of our technology, is that 24/7 automatically and intelligently will log on from every hospital location and facility 24/7, 365, making sure that the EMR, EHR application is up and available for the eventuality of a clinician or healthcare worker needing to access that application. If it's not up and available, our technology will intelligently alert the IT organization so that they can proactively fix the issue before healthcare workers are impacted and there's any collateral issue with the patient care.
So you mentioned, I think a lot of our readers are on Epic or Cerner, the big EMR platforms in larger health systems, but you mentioned Meditech, and they're in place in a lot of smaller community hospitals, I think. Is there a big difference for you guys as far as working? And there's also Allscripts. Is there a big difference for you guys in working with those systems?
No, and if Epic and Cerner both have particular types of their technology that are built specifically for community hospitals. Cerner has Community Works, Epic has Community Connect. So they both offer versions of their technology that can be adopted by surgical centers or small health systems, right? But our technology was purpose-built for healthcare. There is a health IT challenge. And if you think about health IT as sort of a broad statement, if you look at supporting 20,000 users, an enterprise will have twice as many people and twice the budget as a health system will to support the same number of users. So if you think about that, when we built our technology with a tremendous amount of embedded intelligence and automation. So what is commonly said about our technology, it is a purchase of software, but this purchase of software is like adding 2 to 3 full-time employees to your health system's IT staff that are dedicated to monitoring and troubleshooting so that we can, IT can get ahead of end user experience issues that impact patient care.
So when I think about who you're probably dealing with in the health system, my guess is the chief information officer, but have you seen a change in that at all? Other people, other C-suite roles getting involved, like a CMIO, for instance?
Yeah, it's not uncommon certainly we deal with CIOs and down the org chart in IT. That's our primary buyer and user of the technology. However, more often we're seeing the chief medical information officer involved in some of these conversations, because if the clinicians are having difficulty with the EMR, EHR application, a lot of those conversations will flow up through the CMIO. So it's not uncommon for them to be now very much part of the conversation, because there's a whole body of work and research that's gone on now that EMR applications, 96% of health systems have digital medical records. It might even be higher than that. And so there's this whole body of work that's talking about how do we make EMR, EHRs more usable by the physicians and the clinicians. Many times you'll hear of burnout by the healthcare workers and things of that nature. So I think there's a lot of change and innovation over the next 10 years that's going to come looking at the EMR, EHR applications a little bit differently than they were first envisioned, which was really to capture a lot of data, right? So I think there'll be a lot of focus, not just on what we're focused on, which is making the applications themselves available, accessible, so that physicians aren't fighting the technology. But I think there'll be a lot of innovation around making the applications more focused on patient outcomes and patient care rather than merely capturing data.
That's interesting. So do you have any other takeaways or advice for these health IT management folks and CIOs looking to improve the performance for clinicians and users right now?
So from a health IT, that's a good question. So from a health IT perspective, one of the things that we consistently see is that CIOs and IT organizations tend to underspend on the tools that are needed to keep these systems up, running, and available, right? And there are purpose-built technologies like ours that are built for health IT and to keep the EMR, EHRs reliable, accessible, and available to clinicians. So I think it's important to invest in the types of tools that are necessary to be able to deliver a good end user experience to clinicians. Now, that's only one piece of the overall performance and reliability puzzle, but that is the one that we play in.
Well, Thomas, this has been really interesting to think about this aspect of the EHR's important role in the health system and reliability. So thank you for taking the time to talk to us today. I really appreciate it.
I appreciate it, David. It was a pleasure meeting you.
Okay, thanks.